It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on our show today, we're going to hear from Interventional Cardiologist Dr. Annie Varughese and how she was able to help Bill with his heart palpitations.
I was pretty healthy up until I hit my 30s, and when I hit my 30s is whenever I was diagnosed with diabetes, and then from that point on, they start treating you right then for cholesterol. They start treating you for high blood pressure. I had started taking tests, and they changed my blood pressure medicines up. I woke up one morning and my heart was just out of control.
He presented initially with palpitations. Palpitations because of medication that he was taking for high blood pressure. He was not tolerating the medicine. And this medicine is a great medicine for blood pressure, but for him, it caused palpitations. So here's a classic example of how medications are studied, tried and true, used for years, but each patient is their own entity. Each patient processes medications in a different way. And for him, this medication was stimulating his heart, not quieting it down.
I would feel pretty confident that if it kept going the way it was going, I would end up having a heart attack. A lot of blood work was done, and once we pinpointed the problem, we put me on the right medication. I've been fine ever since.
And I had to, of course, immediately take that away, give him other medications that proved to be beneficial for his heart rate and his blood pressure. And he has done very well over several years, been very faithful to our practice, and brought many of his family members because of what we were able to do for him.
As far as how I feel now versus how I felt from the beginning, I feel 100% better, and not having to worry about waking up in the morning and your heart just be racing out of control. It's a good feeling not to have to worry about that taking place again.
Bill is doing fabulous. He is able to run his business. He brings his family members to be checked because he knows that there are rules and you follow the rules. And when you follow the rules, you do well.
The outcome of it is pretty good. I mean, like I said, if you can control it, and I stay on, and I take the magnesium pills, and it keeps everything under control. I haven't had any issues since. I expect to live for a long time, I hope.
Sunflower seeds can help protect your heart. Consuming a quarter cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fights infections.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face, and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Teku, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility. This is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
With these patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion, and it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
To request an appointment with any of the amazing physicians you've seen on the show today, head to our website. It's bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's Podiatrist, Dr. Gabriel Maislos.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or, I can't play golf because I'm just always in pain. And
the plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that honestly, in my practice, I probably see 10 to 15 times a day. So typically someone complains about that first step in the morning when they get down. When you bear weight, okay, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle. And it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The Tenex procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue, and so using ultrasound for guidance and using a micro tip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
To find a doctor on BestDocsNetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you. Stretching can help boost circulation and digestion, and even ease back pain. Remember when stretching to hold each position for about 25 seconds and to breathe deeply.
At Houston Northwest Medical Center, our story began 40 years ago. when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided, the hospital quickly grew into a regional healthcare provider serving not just the immediate area, but really all of North Houston.
When I joined the hospital 23 years ago, the things that stood out were, number one, the facility itself. The facility was second to none with respect to the services it provided.
Houston Northwest Medical Center is well known for the high-quality care it's given since it's been opened. Since the first cardiac procedure in 1984, the hospital has continued to grow.
We do every kind of surgery, from the small to the large. We do from toenails to open heart. We have a very large bariatric program. We did about 500 cases last year.
As the years have gone on, we have been known for cardiovascular surgery. For cardiology procedures, we have a beautiful cardiac cath laboratory. Our OB department has just grown through the years.
The attention to detail is phenomenal. From the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
For more information and to check out hundreds of videos on all the amazing doctors that you've seen on our show today, head to our website. It's bestdocsnetwork.com. Now up next, we're going to hear from ear, nose, and throat specialist Dr. C.T. Nguyen and how he was able to help Aryn with his inability to breathe and nasal congestion.
My symptoms were like I would always wake up in the middle of the night having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aryn is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aryn, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aryn's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes, and Aryn goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe, and now I can. We just appreciate what Dr. Nguyen has done for my life.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day.
Well, the issue, of course, is age and gravity. And so I wanted to do the Ulthera because of it's a really nice lift without any incisions or downtime.
Skin tightening is basically taking a device and taking energy such as heat or radiofrequency energy or ultrasound and tightening the skin to a degree where you can actually see effects. The technology these days will actually harness the energy into a delivery system which is not as painful and gives us better results with less downtime.
I knew that the Ulthera was immediate results. I knew that the downtime was 0, and I also knew that it would be a pretty general facelift, and that's what I wanted.
The Ulthera procedure takes about an hour. There is no downtime. It's non-invasive, so you can have the procedure done and go back to work. There is no bruising associated with it since it is non-invasive. The effects of the Ulthera last about 2 years. And with any type of procedure that you do for tightening, once you have the procedure done, your skin starts aging again.
Have it done. It makes you feel better. It makes your outlook a lot better because you look better, you feel better. And people notice. They don't know what you've done, but they notice that you look great. You look like you have a glow about you. What have you done?
Skin tightening industry these days is really about delivering the best type of energy to get the best type of results. So that's what I like to focus on here at Woodlands Wellness, is that we have researched to find the best procedures for the best results. When we do a procedure, you know that's FDA approved, and it's also going to do the best that we can do to get that result.
You don't have to tell anybody, but other people notice. And it has to do with the brightness in your eyes and just how you feel about yourself, and you want to get up and conquer the world.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Let's talk about gluten sensitivity. You hear a lot about that. People with gluten sensitivity tend to get bloating, gaseousness, but it also can cause things like anemia or fatigue because it washes out your nutrients in your body and causes changes in everything from your energy level to your tests in your doctor's office. Gluten sensitivity is caused by the absence in your small intestine of an enzyme that digests gluten. Gluten is like wheat, breads, and that kind of thing, and starches. If you don't have that enzyme, you build up gas from all the gluten that we tend to get in our diet. How can you tell if you're gluten sensitive? Well, one way is to just take gluten out of your diet. All you have to do is look on the internet and you'll find gluten-free diets. If you get better from your symptoms that worry you by being on a gluten-free diet, then you probably do have gluten sensitivity, and just keep on keeping on that way. Now, one way to tell for sure is you can get a biopsy done in a doctor's office with a scope down your throat, but that's not the best way to do it. Just get a blood test done. If the dietary restrictions don't work.
For additional medical minutes from Dr. Honecker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple. And I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process. And he said, you know, you can always do more, but let's do something modest for now. And it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that, you know, we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually a lot of times just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape a person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
Hi, I'm Dr. C.T. Nguyen with Houston Sinus and Allergy and Best Docs Network. Do you know there's a simple solution to reduce your allergy symptoms? Wash your hair at night. It removes pollen and dust, so you don't breathe them in while you sleep. To learn more on this and other topics, please watch my video at bestdocsnetwork.com.
For more information and to watch hundreds of videos on the doctors you've seen on the show today, head to our website. It's bestdocsnetwork.com. Now up next, we're going to see how Georgianne, who was embarrassed by her smile, was able to start smiling again after a smile makeover from Cosmetic Dentist, Dr. Guy Lewis.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, you know, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. You know, just in a social setting, somebody's snapping candid shots, and I would never, rarely would open my mouth to smile. You know, once I had the smile makeover, I'm just flashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile, and confident about how their teeth look, it changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's, and my mother was across the room from me. My mother's 82 years old, and she looked at me and she said, "Your smile is dazzling." And I was like, "Oh, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone, and after I feel like I can take on the world. I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Did you know that blueberries can help improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1.75 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me. And then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
The patients that I dreaded seeing previously in my practice, now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
Those were some amazing doctors on today's show, but that's going to wrap up this edition of Best Docs Network, featuring some of the best doctors in the Houston area that are really making a difference in people's lives. For more information, head to our website, bestdocsnetwork.com. And if you have a question, a comment, or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.